201. Simvastatin should be taken with food for best absorption. Answer: false. Rationale: simvastatin is best absorbed when taken in the evening, and food does not significantly impact its absorption. 202. Furosemide can cause hypokalemia. Answer: true. Rationale: furosemide is a loop diuretic that increases potassium excretion, potentially leading to low potassium levels. 203. Celecoxib is a nonsteroidal anti-inflammatory drug, NSAID, that does not affect platelet function. Answer: true. Rationale: celecoxib is a COX-2 inhibitor that has a lower risk of gastrointestinal bleeding and does not affect platelet aggregation. 204. Methotrexate is an immunosuppressive drug commonly used to treat rheumatoid arthritis. Answer: true. Rationale: methotrexate suppresses immune function and reduces inflammation in conditions like rheumatoid arthritis. 205. Diazepam is contraindicated in patients with a history of alcohol use disorder. Answer: true. Rationale: diazepam, a benzodiazepine, can enhance the depressant effects of alcohol, increasing the risk of overdose. 206. Prednisone is a corticosteroid that can cause weight loss. Answer: false. Rationale: prednisone typically causes weight gain due to fluid retention and increased appetite. 207. Lorazepam is a short-acting benzodiazepine used to treat anxiety. Answer: true. Rationale: lorazepam is effective for short-term anxiety relief due to its rapid onset and relatively short duration of action. 208. Digoxin can cause bradycardia in patients with a high serum concentration. Answer: true. Rationale: digoxin slows the heart rate, and high serum levels increase the risk of bradycardia and arrhythmias. 209. Spironolactone is a potassium-sparing diuretic that may cause hyperkalemia. Answer: true. Rationale: spironolactone blocks aldosterone, reducing potassium excretion, which can lead to elevated potassium levels. 210. Phenytoin is an anticonvulsant drug that may cause gingival hyperplasia. Answer: true. Rationale: phenytoin can cause overgrowth of gum tissue as a side effect. 211. Metformin can cause hypoglycemia in patients not taking insulin. Answer: false. Rationale: metformin works by improving insulin sensitivity and does not typically cause hypoglycemia unless combined with insulin or sulfonylureas. 212. Heparin is used to treat hypercoagulable states and prevents thrombus formation. Answer: true. Rationale: heparin inhibits clotting factors, preventing blood clot formation. 213. The combination of propranolol and verapamil increases the risk of severe bradycardia. Answer: true. Rationale: both drugs can slow heart rate. Their combined use can dangerously decrease heart rate and blood pressure. 214. Amiodarone is used to treat arrhythmias, but it may cause thyroid dysfunction. Answer: true. Rationale: amiodarone can interfere with thyroid function due to its high iodine content. 215. Diphenhydramine is safe for use during pregnancy. Answer: false. Rationale: although considered relatively safe, diphenhydramine should be used cautiously during pregnancy, especially in the first trimester. 216. The use of lithium in patients with dehydration increases the risk of toxicity. Answer: true. Rationale: dehydration can cause increased lithium levels in the blood, increasing the risk of toxicity. 217. A common side effect of verapamil is constipation. Answer: true. Rationale: verapamil is a calcium channel blocker that can slow gastrointestinal motility, leading to constipation. 218. Glipizide is a sulfonylurea used to lower blood sugar in type 1 diabetes. Answer: false. Rationale: glipizide is used in type 2 diabetes to increase insulin release, but is not effective in type 1 diabetes. 219. A major side effect of methadone is respiratory depression. Answer: true. Rationale: methadone is a long-acting opioid that can cause respiratory depression, especially at higher doses. 220. Vancomycin is an antibiotic used to treat infections caused by gram-negative bacteria. Answer: false. Rationale: vancomycin is effective against gram-positive bacteria, such as MRSA, but not against gram-negative organisms. 221. Isotretinoin is a retinoid that is contraindicated in pregnant women due to teratogenic effects. Answer: true. Rationale: isotretinoin is known to cause birth defects and should not be used during pregnancy. 222. Baclofen is used to treat spasticity in patients with multiple sclerosis. Answer: true. Rationale: baclofen is a muscle relaxant that can reduce spasticity and improve mobility in patients with multiple sclerosis. 223. The use of acyclovir during pregnancy is contraindicated. Answer: false. Rationale: acyclovir is considered safe during pregnancy and is used to treat herpes simplex and varicella zoster infections. 224. The combination of atenolol and clonidine can cause excessive bradycardia. Answer: true. Rationale: both drugs lower heart rate, and when taken together, they can significantly reduce heart rate to dangerous levels. 225. Theophylline toxicity can cause seizures and arrhythmias. Answer: true. Rationale: theophylline, used to treat asthma, has a narrow therapeutic range and toxicity can lead to seizures and life-threatening arrhythmias. 226. A side effect of prednisone is adrenal suppression. Answer: true. Rationale: long-term use of prednisone can suppress the body's ability to produce corticosteroids, leading to adrenal insufficiency. 227. Lisinopril can cause hyperkalemia as a side effect. Answer: true. Rationale: lisinopril, an ACE inhibitor, can reduce aldosterone, leading to decreased potassium excretion and hyperkalemia. 228. Warfarin is an anticoagulant that works by inhibiting vitamin K-dependent clotting factors. Answer: true. Rationale: warfarin inhibits the synthesis of clotting factors 2, 7, 9, and X, which require vitamin K for activation. 229. Aspirin should not be used in children with viral infections due to the risk of Reye syndrome. Answer: true. Rationale: aspirin has been linked to Reye syndrome, a rare but serious condition that can cause liver damage and encephalopathy in children. 230. Dextromethorphan is an opioid used to treat cough. Answer: false. Rationale: dextromethorphan is a non-opioid cough suppressant that works by suppressing the cough reflex. 231. Hydrochlorothiazide is a thiazide diuretic that may cause hypokalemia. Answer: true. Rationale: thiazide diuretics increase potassium excretion, potentially causing hypokalemia. 232. Clopidogrel is an anticoagulant used to prevent blood clots after surgery. Answer: false. Rationale: clopidogrel is an antiplatelet drug, not an anticoagulant, used to prevent thrombus formation by inhibiting platelet aggregation. 233. Carbamazepine can cause hyponatremia as a side effect. Answer: true. Rationale: carbamazepine, an anticonvulsant, can cause sodium retention, leading to low sodium levels. 234. Albuterol is a beta-2 agonist used to treat asthma exacerbations. Answer: true. Rationale: albuterol works by relaxing the bronchial smooth muscle, improving airflow, and relieving asthma symptoms. 235. Dantrolene is used to treat malignant hyperthermia. Answer: true. Rationale: dantrolene is a muscle relaxant that treats malignant hyperthermia by inhibiting calcium release from muscle cells. 236. Terazosin is used to treat high blood pressure and benign prostatic hyperplasia. Answer: true. Rationale: terazosin is an alpha-1 blocker that relaxes blood vessels and the smooth muscle of the prostate. 237. Insulin glargine is a rapid-acting insulin used to treat hyperglycemia. Answer: false. Rationale: insulin glargine is a long-acting insulin, providing a steady level of insulin throughout the day. 238. The use of vancomycin can lead to red man syndrome. Answer: true. Rationale: rapid infusion of vancomycin can cause a histamine reaction, leading to flushing and rash, known as red man syndrome. 239. Rifampin can cause liver toxicity and should be monitored. Answer: true. Rationale: rifampin can cause hepatotoxicity and liver function should be regularly assessed during treatment. 240. Nifedipine is a calcium channel blocker that can be used to treat hypertension and angina. Answer: true. Rationale: nifedipine relaxes smooth muscles, lowering blood pressure and improving blood flow to the heart. 241. Diphenhydramine is effective as a sleep aid for chronic insomnia. Answer: false. Rationale: although diphenhydramine can cause drowsiness, it is not recommended for chronic insomnia due to its anticholinergic effects and potential for tolerance. 242. Insulin is used to treat both type 1 and type 2 diabetes. Answer: true. Rationale: insulin is primarily used in type 1 diabetes and can be used in type 2 when oral medications are insufficient. 243. Metoclopramide is used to treat nausea and vomiting, but it can cause tardive dyskinesia. Answer: true. Rationale: metoclopramide increases gastric motility and reduces nausea, but long-term use can lead to movement disorders like tardive dyskinesia. 244. Bupropion can be used to treat depression, smoking cessation, and as an adjunct for weight loss. Answer: true. Rationale: bupropion is used for depression, smoking cessation, and weight loss, but it can lower the seizure threshold. 245. Ethambutol is an antibiotic used to treat tuberculosis. Answer: true. Rationale: ethambutol is used in combination with other drugs to treat tuberculosis, and it can cause optic neuropathy as a side effect. 246. Cimetidine is a histamine 2 blocker that reduces stomach acid production. Answer: true. Rationale: cimetidine inhibits histamine receptors, reducing stomach acid secretion, useful in treating ulcers and GERD. 247. The use of nitrates can cause hypotension, especially when combined with erectile dysfunction drugs. Answer: true. Rationale: nitrates dilate blood vessels, lowering blood pressure, and combining them with erectile dysfunction drugs like sildenafil can lead to severe hypotension. 248. The use of zolpidem is recommended for long-term treatment of insomnia. Answer: false. Rationale: zolpidem is intended for short-term use due to its potential for dependence and tolerance. 249. The main side effect of sildenafil is headaches. Answer: true. Rationale: sildenafil can cause vasodilation, leading to common side effects like headaches. 250. Azithromycin is a macrolide antibiotic used to treat bacterial infections. Answer: true. Rationale: azithromycin works by inhibiting bacterial protein synthesis and is used to treat respiratory and other infections.